to the deep dive, where we cut through the noise to give you the essential insights you need to be truly well informed. Today, we're plunging into a topic that feels like it's evolving with every breath. Artificial intelligence, it's undeniably reshaping our world at an incredible pace. And for many, a big question lingers. What does this mean for something as personal, as intimate as healthcare? There's a natural concern, that the rise of AI might mean losing that crucial human touch that defines compassionate care. Our mission for this deep dive is to really explore how AI is being used in Canadian healthcare right now. And importantly, it's not about replacing, but rather about enhancing human connection and care. You've shared some truly fascinating insights highlighting how what we're calling human first innovation in a digital age is not just a concept, but, well, it's becoming a tangible reality. So let's unpack this.
Yeah.
The core idea here seems to be that AI can actually help address some of our most pressing challenges, like workforce shortages and the growing complexity of care. And by doing that, it enables healthcare professionals to do more human work, not less. Is that about right?
That's precisely the shift we're observing. Yeah. What's becoming abundantly clear is that the conversation isn't really about if AI will replace the human side of care anymore. It's shifted to how. How can we strategically and wisely integrate it? The goal is improving coordination, easing administrative burdens, providing robust support to clinicians, all while keeping people and their relationships squarely at the heart of care. Across Canada's health systems, AI is quietly but powerfully reshaping how care is delivered, managed, and ultimately experienced. So today, we're going to walk you through 7 proven ways AI is accomplishing exactly that.
Okay, great. Let's kick things off then. Point one relates to something that, honestly, if you've ever spoken to a clinician across Canada, you've heard about it. The sheer overwhelming volume of paperwork. It's one of the biggest complaints, hours upon hours spent each day buried in electronic medical records, EMRs they call them. And this often comes at the direct expense of meaningful patient connection. It's just a massive burden. It really drains time and energy they could be giving to patients. Makes you wonder, can tech actually solve a problem tech kind of created?
That's a critical question. And maybe, surprisingly, the answer seems to be yes. We're seeing a new generation of AI scribe tools, things like Nuance, DAX Copilot, Zuki, Scribe, EMR. These aren't just simple dictation services. They're designed to actively transcribe, summarize, and format visit notes, in real time. They intelligently capture the essence of the conversation.
Okay, so it's more sophisticated than just voice to text.
Much more. And the impact is significant. These tools are dramatically cutting down charting time and the cognitive fatigue that goes with it. They're essentially freeing clinicians from the keyboard. We heard from an Ontario family physician, part of a 2024 pilot, who shared that with DAX Copilot, they weren't just saving time, they were, and I quote, showing up more present with my patients.
Wow, that's powerful. It's not just efficiency, it's presence.
Exactly. It's about restoring presence, letting clinicians reclaim that invaluable human connection that paperwork often erodes. And the numbers back this up. A 2024 study by Ontario MD found family doctors using this kind of AI scribe tech reported spending 70% to 90% less time on paperwork.
70, 90%.
Yeah, saving 3 to 4 hours per week on admin tasks.
That's huge. 3 to 4 hours back.
It is. And as Paul Method, who's the Chief Artificial Intelligence Officer at Serefin, wisely notes, AI is a powerful partner. Yes, it enhances efficiency and accuracy, but, and this is key, it is not a substitute for empathy, intuition, or human connection. He stresses, in healthcare, the human touch remains irreplaceable. And AI helps us preserve it by allowing clinicians to focus more on people, not paperwork.
Right. People, not paperwork.
And focusing on people directly improves things like continuity and follow-up. Those are, of course, key pillars of effective care coordination.
Okay, that makes a lot of sense. Let's move to the second point. This is where it gets really interesting for proactive care, I think. The idea of identifying individuals who need the most support before they reach crisis points. Imagine preventing people from falling through the cracks entirely, not just, picking up the pieces afterwards. It sounds like a game changer. But I guess for some, maybe raises questions about data privacy. Are there ethical things to keep in mind here?
That's a really important point to acknowledge. And yes, absolutely. While we won't dive deep into data ethics today, it's crucial to state that responsible, secure data handling is absolutely paramount in all these applications. But focusing on the capability, at its core, AI excels at surfacing hidden risk factors across these vast, often anonymized data sets. It does this by spotting subtle patterns, correlations, that are just, frankly, beyond human capacity to process at that scale.
Okay, so it sees things we might miss.
Exactly. In Ontario, for instance, predictive models are actively used to identify patients at high risk for hospital readmission, or for needing alternate level of care, ALC status.
Right, ALC.
Yeah.
That's when they're medically stable but stuck in a hospital waiting for care elsewhere.
Precisely. Waiting for a more appropriate setting like long-term care or home care. And a 2023 study in the Lancet Digital Health found that these machine learning models improve the prediction of 30-day hospital readmissions by up to 20% compared to the traditional scoring tools.
20% better prediction. That could prevent a lot of readmissions.
It really could. And another powerful example is in Alberta. The strategic clinical networks there are piloting AI tools to help prioritize patients with multiple chronic conditions who could benefit most from community-based case management.
So targeting support where it's needed most.
Right. It helps interdisciplinary teams plan proactive outreach. They can connect patients with nurses, social workers, care navigators before an avoidable trip to the emergency department happens. So this isn't just about catching illness earlier. It's really a fundamental shift in healthcare, moving from purely reactive treatment towards proactive prevention. It allows us to intervene when risk is maybe just a whisper before it becomes a crisis.
A whisper of risk. I like that framing.
And this ability to proactively target team-based interventions, especially in transitional care, home care programs, that's just a cornerstone of smart care coordination.
Okay, got it. Now, number 3, navigating the system itself. It can often feel like a maze, can't it? Especially with all the approvals needed, the forms, checking coverage. This administrative bottleneck causes real delays in care. Patients get frustrated, anxious, waiting too long. It seems ripe for innovation. But I wonder, for patients, does using AI for streamlining risk-making an already sometimes impersonal system feel even colder, even if it's faster?
That's a really valid concern, and honestly, it's a key design principle. The aim is always to ensure AI enhances, not diminishes, the human connection. So in this instance, AI's role is really about clearing the administrative path, reducing that burden significantly. How? Well, it does this by intelligently triaging requests, automatically checking eligibility against complex rules, and flagging incomplete submissions for a human to review. Ultimately, it speeds up the path to getting care.
So it handles the straightforward stuff, freeing up people for the complex cases.
Essentially, yes. Canadian health systems are definitely exploring AI-powered referral triage right now to cut down delays and improve access. And a 2023 Deloitte survey found that 40% of hospital executives reported meaningful improvements in areas like appointment scheduling and referral writing after the integrated AI solution.
40% saw real improvements.
Yeah. And think about platforms like Salesforce's Agentforce. It shows how technology can be trained to understand these complex healthcare workflows. It can surface documentation needs automatically, flag gaps, accelerate decisions around referrals and authorizations.
So it's making the system work better behind the scenes.
Exactly. Making the system work for people by streamlining those often invisible processes rather than just shifting the burden around. These AI-powered admin tools help smooth out transitions, especially between primary care, community services, and hospitals. That's absolutely crucial for coordinated care.
Right, smoother transitions are key. Okay, number 4, diagnostic accuracy. This is obviously paramount. Accuracy in diagnosis is the bedrock of good care. It's such a high-stakes area. Even the most experienced professionals can benefit from a reliable second reader, right? So what role is AI starting to play here, particularly in fields like radiology, where that second set of eyes is so critical?
You're absolutely right. Diagnosis is paramount, and AI is already proving its immense value as a complementary second reader. We're seeing it in radiology, pathology, even dermatology. For instance, a tool called ADOC is being adopted in parts of Canada. It helps flag urgent scans that might otherwise get buried in a backlog. This directly reduces wait times in reading rooms.
Cutting down those stressful waits for results.
Precisely. And think about cancer care coordination, a really high-pressure area. These tools can accelerate the diagnostic process, ease bottlenecks, which leads directly to faster development of care plans and, critically, can improve survival outcomes.
That's incredibly significant.
It is. And there's compelling data. A 2024 nationwide study, published in Nature Medicine, found something remarkable. Radiologists using AI support achieved a 17.6% higher breast cancer detection rate compared to the standard double reading by 2 radiologists.
Wow, nearly 18% higher detection.
Yes, and crucially, this was achieved without increasing the number of false positives.
Okay, so better detection without more unnecessary scares or biopsies. That's key.
Absolutely key. It highlights that AI's role here isn't about replacing the expert human eye. It's about amplifying human precision. It offers a level of diagnostic confidence and speed that honestly was previously unimaginable.
Amplifying human precision.
And from that care coordination angle, faster, more accurate diagnostics directly support timelier referrals, more focused case conferences between specialists, and clearer communication with the patient. This is especially vital in oncology and chronic disease pathways where, every moment really counts.
No question. Time is critical there. Okay, point 5 takes us to mental health. Canada is grappling with the significant mental health access crisis. It affects so many people, particularly youth and underserved populations. It's a huge societal challenge. And it makes you wonder, how can something like AI, which can feel impersonal, help bridge this critical gap? How can it ensure support is there when it's most desperately needed? Someone struggling alone at 3 a.m. when reaching a person feels impossible.
That's exactly the kind of scenario where these conversational AI platforms, things like Wiza, Wobot, Tess, are making a real difference. They step in to offer CBT-based self-guided support available 24/7.
CBT, cognitive behavioral therapy.
Exactly. A well-established, evidence-based approach for managing mental health challenges. So these tools help users manage anxiety, build coping strategies, de-escalate stress, often acting as a crucial first step or a bridge to further human care. Think about that person struggling at 3 a.m. Reaching a human professional then is incredibly difficult. Conversational AI doesn't just offer generic advice. It offers immediate companionship and practical coping strategies during those really vulnerable hours. It's a critical bridge.
Available anytime, anywhere.
And there's evidence it helps. A 2022 peer-reviewed evaluation, for instance, showed over 70% of WISA users reported improved mood within just 2 weeks.
That's impressive.
It is. And what's truly powerful here is the use of advanced sentiment analysis. That's a form of natural language processing.
Teaching computers to understand language.
Right. Understanding, interpreting, even generating human language. It can detect emotion, tone, and potential risk in real time. This tech is being used more and more in mental health call centers and therapy chatbots. If the system flags significant distress or, say, suicidal ideation, it can immediately escalate that case to a more experienced or specialized human mental health professional.
So it ensures faster, safer care when it's most critical.
Exactly. It can even systematically analyze language patterns across huge data sets, like the language used in over 110,000 reviews of suicide prevention apps, classifying sentiment with up to 87% accuracy. This helps identify critical language patterns, enabling timely check-ins or referrals by human teams.
So it's augmenting the human teams, not replacing them.
That's the core message. Conversational AI isn't about replacing people. It's about empowering human teams to respond sooner and more effectively. These tools act as a scalable first touchpoint, freeing up care coordinators and clinicians to focus their time on individuals with more complex or urgent needs.
Got it. Scalable first touch point. Anyway, number 6. Virtual triage. Getting to the right provider at the right time. Absolutely critical for efficient healthcare. Many of us have experienced that frustration not knowing where to go, maybe ending up in the ER when a walk-in clinic or even a virtual visit would have been better. That kind of misdirection creates unnecessary wait times and strains the whole system.
You've described the problem perfectly, and this is exactly where AI symptom checkers and virtual triage bots like Babylon, Ada are gaining significant traction across Canada. And these aren't just glorified flowcharts. They use quite sophisticated algorithms to help patients assess their symptoms, get reliable advice based on established protocols, and then actually book the appropriate care pathway. This directly helps reduce unnecessary emergency department visits and eases overall wait times.
Is there data on that? Does it actually reduce ER visits?
Yes, there is. A study published in JMR, for example, showed that AI triage bots reduced unnecessary emergency visits by up to 15% when they were integrated into virtual primary care models.
15% reduction. That's substantial.
It is. And we're seeing real-world pilots, too. The Saskatchewan Health Authority, for instance, is currently piloting a nurse-supported AI triage system in Regina and Saskatoon. The system helps guide non-emergent callers toward the most appropriate care options for their situation. This reduces unnecessary ambulance dispatches and takes pressure off their emergency services.
So it's guiding people more effectively from the outset.
That's the idea. What's truly impactful here is that these tools create a kind of smart gateway to care. They help match patients to the right provider at the right time. And that, of course, is an essential first step in any well-coordinated care journey.
Smart gateway. Makes sense. Okay, finally, point 7, moving beyond individual care to population health. What about the health of entire communities? Can AI help decision makers plan system-wide responses, address broader public health challenges? How does it help ensure resources go where they're needed most across a whole population? How does AI pull that data together?
That's an excellent point about scale. And yes, AI is exceptionally good at synthesizing vast amounts of disparate data sources. It can analyze public health data, EMS trends, that's emergency medical services activity pharmacy, dispensing data, looking for patterns, tracking early signs of health crises.
Like an early warning system.
Exactly. For instance, in 2023, the Public Health Agency of Canada, PHAC, piloted an AI dashboard specifically designed to track early indicators of opioid overdoses across the country. By spotting trends faster, this led to quicker deployment of naloxone.
Naloxone, the overdose reversal drug.
Right. National efforts supported distributing over 92,000 kits, significantly enhancing the ability to reach communities earlier, potentially saving lives.
That's a tangible, life-saving impact.
Absolutely. Yeah. And beyond immediate crises, provincial health systems are also starting to use AI to map chronic disease risk geographically. They can identify underserved areas where things like mobile health clinics or social prescribing pilots might have the biggest impact.
So using data to target interventions more precisely.
Precisely. It's about forecasting community needs and using data to guide smarter, more equitable resource deployment across the system. But the real value emerges when those AI-generated insights are paired directly with local knowledge, with local providers, community workers, care navigators, to deliver targeted, effective public health initiatives that actually make a difference on the ground. It needs that human element to translate insight into action.
Right. The AI provides the map, but people navigate the terrain.
That's a great way to put it.
So wrapping this up, what does this all mean for healthcare? What we've seen today are 7 really compelling ways AI isn't just a buzzword, it's a practical, impactful tool making a tangible difference right now across Canadian healthcare. It really drives home this idea of building AI-ready, human-led health systems. Where AI supports human care, it doesn't try to replace it. It feels like the message is you really don't have to choose between innovation and compassion. They can, and maybe they must, go hand in hand.
Indeed. And if we connect this back to the bigger picture, it really highlights that in today's complex system with fragmented services, rising needs care coordination is more essential than ever before. AI offers a powerful new set of tools to bring more focus, more precision, and hopefully more equity to that crucial mission. As we move forward, though, I think a crucial consideration for everyone involved, leaders, innovators, clinicians, patients, should be to evaluate AI through the lens of relationships, not just purely based on quantitative results or efficiency metrics.
Relationships matter.
They do, and it's imperative that we center community voices, equity considerations, and solid ethical design principles in every single AI decision. We need to ensure these tools truly serve everyone fairly. And critically, we absolutely must invest in AI tools that genuinely reduce burnout and improve continuity for our dedicated healthcare workers. They're the heart of the system.
Absolutely. Support the humans doing the caring.
Yes. And this perhaps leads to an important question for you, our listeners, to ponder. As AI continues its rapid evolution, how might we as a society consistently ensure these incredibly powerful technologies are deployed in ways that amplify our collective humanity and our capacity for care, rather than diminishing it?